Tricia, can you say your full name for me and your date of birth?
Okay, it's Tricia Giancola, 4/17/1953.
And it's Dr. Tramontosi today?
That is correct.
Okay, and it's spelled TRISHAGIANCOLA.
That is correct.
Okay. And no allergies?
No.
Okay. And what are we doing for you today?
We're doing, we're opening up the incision on my left leg, clean out all the cancer cells.
Okay.
Left calf.
Okay, can you point to the site for me? Okay, very good.
I talk about the universal protocol, and it is part of patient safety. We're very committed to patient safety here at Bacchus. As we take care of our patients, we realize that it's a very complex system, and patient safety is about supporting the people who take care of patients. When I go to the airport and get on an airplane, I'm very happy to see the pilot going through the checklist. I always look at that. I want to make sure they know the gas tank is full and that all the switches are in the right position, and that's what the universal protocol is about. We need to make sure that we have the right patient, the patient is marked, we have verification of the process, and that we can extend this process to wherever we use procedures for patients. And the universal protocol is the basis for this. Healthcare is complex. We need simple things to give us a foundation to make sure patients are safe. At this hospital, at every other hospital, we recognize this. We see headlines all the time from other hospitals about wrong-sided surgery, medical mistakes. Patient safety is about keeping patients literally safe from these errors. The universal protocol is, I think, the foundation in the surgical suite and in procedures throughout the hospital to make this happen.
I don't see no one.
Okay, I'll give you this and I'll continue with this. If you could please state your name and date of birth.
Tricia Giancola, 4/17/1953.
Medical record number is 358324.
358324.
And her digits 4834.
4834.
Tricia, can you tell us what you're having done today, please?
I'm having an incision on my left leg opened up more.
The universal protocol, like so many other things we do here at the hospital, is going to require a tremendous amount of teamwork. This process is actually going to start before the patient actually comes to the hospital. It'll start when they schedule their surgery at the surgeon's office, and it'll take place while they're at pre-admission testing, all the way through getting set up in the morning at same-day surgery, and then the timeout process. It's going to mean that we have to communicate a lot. We're going to have to help each other make sure we do the right things and that we do them over and over again, and that we make sure that when there's a problem that we all stop and take the time to figure out what's going on and work together to encourage each other to do it correctly. So please, while you're working on all of this, make sure that you encourage each other, work together, and know that your patients really appreciate the time and effort that you're putting into this.
I'm out.
I'm out.
Tricia Giancola, birth date 4/17/53. Wide incision, malignant melanoma, left calf. Okay?
Yes.
Tricia, wide excision, malignant melanoma.
Wide excision, malignant melanoma, left leg.
Yes. The reasons that everyone says that we make the mistakes. The reasons are that we're too busy. The reasons are that we got some information, that the communication between staff members weren't exactly where it should have been, that we were pressed for time. But we know the reasons now. So now that we know the reasons, we need to get to the solutions to those reasons. And again, the protocols are set in place to attack every one of those reasons and make it be preventable so that we don't have a wrong error on any of our patients. It's very serious, and every one of us needs to take this serious. Every one of us has a role in this, even the patients. Encourage the patients to be part of this. Do the steps every time. Encourage your peers to do the steps every time. It's the expectation of this organization that we give perfect care, that we do no harm, and that we correct any errors and any potential for errors. So do the same steps every single time, because what's redundant to you is new to those patients that put their trust in you to keep them safe.